Hi, I'm Harris Harrington, creator of depersonalizationrecovery.com. The topic of this video is OCD and depersonalization disorder. So OCD encompasses a lot of different things, and when people think of OCD, they usually think of hand washing or card counting or compulsive behaviors, like if somebody's driving on the road. Sometimes they'll think they'll have hit somebody and they'll feel the compulsion to drive back to check in the place they think they've hit somebody. These are kind of compulsive behaviors. But another element, another kind of branch of OCD that few people actually think about or actually isn't studied that much is pure O, or purely obsessive OCD. And this is where you have intrusive, obsessive thoughts you can't get out of your head that are usually uncharacteristic of the self. They're what you call ego-dystonic. So one thing you might experience, one symptom you might experience, or that people with pure O experience, is when they drive down the road, they feel the urge or the idea to turn into oncoming traffic. Or if you're standing on the sidewalk, you might think, what if I jumped in front of these cars? And this thought kind of intrudes in your head. Or there's actually suicidal OCD, where like you're walking by your kitchen and you see a knife and you think, what if I grab the knife and stab myself? And you're kind of afraid, right? It's an anxiety disorder. You're afraid of doing this. Some people have, if they're in a checkout line, they might be thinking about saying something really offensive to the person who's checking their groceries, right? Saying just something really mean to that person. They feel the urge to kind of do it, even though they don't want to do it, but they're afraid that they might do it. So that's kind of the fear in pure O, is that the fear of possibly doing something uncharacteristic of the self. Some people have homosexual OCD, where they're worried that they're becoming homosexual and they watch, like heterosexual pornography and try to convince themselves that they're not homosexual. So there's all these different manifestations of pure O. Another element of pure O is just being obsessed with, say, breathing, or thinking about your blinking, or thinking about your swallowing, kind of thinking about unconscious bodily symptoms. So depersonalization, a big component of it is obsession. People think about being depersonalized. So depersonalization, you feel very cut off. You feel different than how you used to feel. You feel an altered sense of reality that people usually say is unreality. And what people do is they check to see how kind of real they feel, or how crisp their sensory integration is, right? They're always checking to see how real they feel. And this obsessional thinking, the obsession of the disorder and the obsessional rumination in depersonalization, is in many ways similar to pure O. It's very intrusive thinking that is hard to get rid of. So these two disorders are extremely interrelated. And I actually have another video on obsession and depersonalization that is really key in watching if you are suffering from these problems. There's a lot of different exercises and a lot of things you can do to get these obsessions out of your head if you have depersonalization. Now, a big part of it is just that you feel these things and you think these thoughts when you have a lot of stress. So if you are experiencing a lot of stress, then you're going to have these problems, and you need to engage in stress reduction to kind of lower these feelings. All right. In addition to the exercise I have in my obsession video, and I also talk about obsession in my 10-hour program, the Total Integration Method. But it is very fascinating, and I think it's very useful if you have depersonalization to understand that there's this whole other branch of OCD called pure O. And I've read some studies, somewhere about 25% of people with DP or thereabouts also have full-blown OCD of some form or another that is just comorbid. And the big thing you need to do is just kind of accept the thoughts as they're there. Okay, so acceptance and commitment therapy has some good ideas. One idea is just to see your thoughts as as the contents of your mind, and they come and go, and it's not really necessarily a part of you. It's not a part of you if a thought comes into your mind. And when you try to get rid of the thought or say, no, I don't want to think that thought, you're actually going to increase the obsession, right? So what you resist persists, or so they say. So if you resist these intrusive thoughts, they often get worse. And this is the thing with obsessions, with kind of compulsive thoughts, compulsive behaviors. The more you try to kind of resist and kind of go, tense your muscles and just say no, the worse they get. So it's better just to accept that they're there and not think that they're very significant. If you think that these thoughts are real significant and that they mean that you're really going to kill yourself, that you're really going to drive off the road, that you're really going to say something mean to someone, that you're really confused about your sexuality, if you really give a lot of credit to these thoughts, then they're just going to become more common because your brain focuses on things that it deems important. So don't see them as very important. So those are just some tips for people that might have OCD thoughts and depersonalization. I've definitely had some pure O mixed in, with my depersonalization, which I got over years ago. But OCD can be very tenacious. The obsessional qualities, obsessional things in depersonalization can be very tenacious and long-lasting. And, you just kind of have to work at it, ease into it day by day, and the thoughts will lessen over time. So I hope this video was helpful. Check out my website, subscribe to this video, more videos are coming, and take care.